the enzyme that causes resistance to the chemotherapies that are used today in the treatment of glioblastoma is something called MGMT. That stands for 0,6-methylguanine methyltransferase, which is a very long word, but it simply means that this enzyme's job is to fix damage at a certain point on DNA, which is the 0,6 position of guanine. It's a naturally occurring enzyme that we all have, and most of us have a lot of it because its job is to protect us from things that damage that part of your DNA. Unfortunately, the drugs that are currently approved as chemotherapies for the treatment of glioblastoma try to damage DNA at that point. And so most of us who have a lot of that enzyme are not very responsive to those drugs because the enzyme works against the mechanism of the drug as it's trying to fight the cancer. One of the exciting things about MGMT is that it's readily detectable. There are laboratory tests that are used today as a prognostic in the pathology lab, readily available, and patients and doctors use those to determine whether or not the patient is likely to respond to today's chemotherapies. The nice thing is that we can use that same test to identify the patients who are unlikely to respond to today's chemotherapies and focus their treatment around VAL083 as we go forward.